Most people discover they have a hernia the hard way, a nagging discomfort that escalates, a lump that appears where it should not be, or a sharp pain during a moment of physical strain. The common assumption is that hernias can be managed carefully over time. They cannot. Dr. Mercola explains that a hernia is a progressive weakness in muscle or tissue that will not repair itself. The longer the repair is delayed, the more complicated and risky the eventual surgery becomes, and the window for a straightforward fix gets smaller.
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello and welcome to Dr. Mercola's Cellular Wisdom.
The first critical decision after a hernia diagnosis is choosing the right surgeon. And Dr. Mercola is direct that this requires active effort rather than passive acceptance of whoever is first available. 3 qualities matter most: documented experience with hernia repairs specifically, clear communication about surgical options and materials, and genuine willingness to advocate for the patient's preferences rather than defaulting to the most convenient approach. In his own experience, Dr. Mercola chose a surgeon not only for technical skill, but because that surgeon was willing to pursue the specific mesh material he wanted, even when it required extra steps.
Hernia repair surgery offers 2 primary approaches. Open surgery involves a larger incision that allows the surgeon to directly access and repair the defect. Minimally invasive techniques, laparoscopic and robotic procedures, use smaller incisions and a camera to accomplish the same repair with less tissue disruption. Both approaches can produce effective outcomes. The right choice depends on the type and location of the hernia, the patient's overall health, and the surgeon's specific experience with each method. Dr. Mercola recommends patients ask directly about both options rather than accepting a single recommendation without understanding the alternatives.
The mesh decision deserves careful attention. Most modern hernia repairs use mesh to reinforce the repaired tissue, and the type of mesh matters significantly. Dr. Mercola outlines 3 categories: synthetic mesh, typically made from polypropylene, which is the most widely used and least expensive; biologic mesh derived from animal tissue, such as surgasis, made from pig intestine, which Dr. Mercola personally chose because it integrates with the body's own tissue rather than remaining as a permanent synthetic implant; and hybrid mesh that combines synthetic and dissolvable materials and is favored by many surgeons for ease of placement. The direct question to ask any surgeon is what mesh they recommend, what their reasoning is, and whether an alternative is available if you have a preference.
Recovery from hernia surgery is consistently underestimated by patients. The realistic minimum is at least 1 full week of meaningful downtime, and planning for someone to assist at home during that period is not optional. It is essential. Pain management requires active attention during the early days, rather than heroic avoidance of all support medications, but also not indefinite dependence on them. Any exercise and strenuous lifting must be completely avoided during the healing window. Dr. Mercola is emphatic that premature physical exertion is one of the most common causes of complications after hernia repair, and that the body's need to heal does not compress to fit an inconvenient timeline.
A practical note from Dr. Mercola involves digestive support during recovery. Anesthesia and post-operative rest significantly slow the digestive system, making bowel regularity a real concern in the first days after surgery. A delayed-release butyrate supplement can support the colon directly by fueling colonocytes, the cells lining the colon, and helping maintain gut barrier integrity when normal digestive activity is reduced. Magnesium at a gently supportive dose provides an additional option for promoting regularity without the harsher effects of other post-surgical interventions.
The broader principle Dr. Mercola draws from this experience extends to all medical decisions. The healthcare system tends to reward passive patients who accept default recommendations without question. Active patients, those who research their condition, ask specific questions about technique and materials, understand their options, and advocate clearly for their own preferences, consistently receive better care and better outcomes. The quality of your surgical result often correlates directly with the quality of the questions you asked before you entered the operating room.
Here's the question worth thinking through before any medical procedure. Have you ever actively advocated for a specific approach or material during a surgical decision? Or have you always accepted the first recommendation without exploring alternatives? Drop a comment and tell us whether speaking up in a medical setting has ever changed what you received. Thank you for listening to Dr. Mercola Cellular Wisdom. See you in the next episode.
Looking for trusted health wisdom you can hold in your hands? Discover the life-changing books of Dr. Mercola at joyhousepublishing.com. These titles bring decades of natural health research into practical steps for better energy, stronger immunity, and clearer thinking. Take charge of your health with guidance rooted in science and experience. Visit joyhousepublishing.com now and claim your bonuses while they are available.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.